Hello all, this is Dr. Alsup, and in this video we're going to focus on the muscles of the thigh region. So mostly going to act on the knee joint, and some are going to also act on the hip joint. So we're going to focus on three main compartments, and there'll be some oddities within the compartments, and we'll point those out, but there are going to be three compartments we're going to focus on: the anterior, the medial, or the adductors, and the posterior compartment. So we're going to start with the anterior compartment, and these first two muscles are often kind of lumped in with the anterior compartment, but there are some distinct differences, as in they're not part of the quadriceps portion of the anterior compartment, but they are important nonetheless, so we're going to point them out. So starting with the iliopsoas muscle. The iliopsoas muscle is going to be the chief flexor of the hip joint. It is going to be the most powerful of the hip flexors. But what's unique about this muscle is that even though it is one of the most powerful muscles in the body, it is mostly hidden in terms of its muscle bellies. Most of its muscle bellies are located in this posterior wall of the abdomen, so actually having attachment on the vertebral columns, as you can see here, or vertebral column, as well as having a portion on this false pelvic region right here. And these are actually two different muscles. You'll have the iliacus and the psoas major. So iliacus is here, psoas major is here, and they will kind of come together or coalesce to have a common tendon. And at this point, we would call this iliopsoas. You wouldn't call these the two different muscles. And that common tendon will have its distal attachment on the lesser trochanter of the femur. So not that greater trochanter. It's going to be on that more posterior, smaller, lesser trochanter. And so you can see if this muscle contracts, it would kind of pull up or pull anteriorly the hip joint or the femur, so allowing for flexion of the hip joint. So really this muscle is neat because it is going to not only have an attachment to the femur, but it's also going to have an attachment to the vertebral column as well as the pelvic girdle, and it's really the only muscle that will cross those three regions. So while it is also that chief flexor of the hip joint, just because of its other attachments, it's also capable of moving the trunk. So if you have bilateral contraction, or contraction on both sides of this muscle, that will allow or initiate contraction or flexion of the trunk. It's also a postural muscle that is going to be active during standing. But if you look down in this region right here, it is almost completely covered by all these other muscles in this region. So you really can see the muscle bellies of iliacus and psoas major here coming together, and then you kind of lose that tendon because it's being covered by the rest of the anterior compartment. Another muscle that's not nearly as powerful, but it is a fairly prominent muscle in terms of visibility, is going to be the sartorius muscle, which is often referred to as the Taylor's muscle, and we'll talk about why in a moment. This is the longest muscle in the body. It is going to begin proximally kind of on this more lateral portion, the anterior superior iliac spine region of the ilium, and it will actually extend all the way medially to the tibia. So it not only will cross the hip joint, but it will also cross the knee joint. It is actually going to be less a part of the anterior compartment. It's actually superficial to the majority of the anterior compartment. It even has its own distinct fascial sheath, so it'll be separated from those. And as I mentioned, it crosses two joints, but it is a fairly weak muscle in terms of its contraction power, so it'll be more of a synergistic muscle. It will play a role for the hip joint in terms of weakly flexing, abducting, and laterally rotating the hip joint. And then it will play a very weak role in terms of flexion of the knee joint. And if you kind of put those actions together, this would allow someone to sit in a cross-legged position, which was a fairly common position that many tailors would work in, so that's why it gets its name. But again, this is really important. This is mainly a synergistic muscle. It will need to act with other muscles to produce those movements in a more forceful way. Okay, moving on to the big muscle in terms of the anterior compartment of the thigh, and that is the quadriceps femoris. Literally, quadriceps femoris means four-headed femoral muscle, and that it just pretty much wraps it up with a nice little bow in terms of what this is. These are going to be collectively a two-joint muscle, but it's really only that rectus femoris that is crossing the hip joint. The majority really are playing a role in terms of extending the knee joint. So it is going to be the great extensor of the knee. It's particularly important in terms of that more forceful contraction to allow for extension. So think of rising from a sitting position or squatting, or from a squatting position, climbing or walking upstairs. So this is going to be for those more forceful extensions. And it's often considerably stronger than its antagonistic group, those hamstrings on the posterior thigh. So with conditioning, this is a particularly robust, strong muscle. And these tendons are going to unite. So all four of those heads are going to unite and form the quadriceps tendon. And the patella will be formed within the quadriceps tendon. Recall that the patella is a sesamoid bone. What's distinct about a sesamoid bone? They form in tendons, right? So that's what the patella is exactly doing. It's forming within the quadriceps tendon. And from the patella down to the tibial tuberosity, then we call that the patellar ligament because it's from bone to bone. And then you'll also have extensions of the tendons that will form the medial and lateral patellar retinacula that kind of serve to finish off or kind of serve that additional protection of the anterior portion of the knee joint. So there's four muscles, as we mentioned. The rectus femoris is the one that kind of runs right down the middle. It's usually the most visible of the muscles. Rectus means straight, and that's exactly what it's doing. It's running straight down the thigh, and it's the one that crosses the hip joint as well as the knee joint, so it can play a small role in terms of flexion of the hip. The other muscles are going to kind of tell you exactly where they will be located. The vastus medialis will be medial, the vastus lateralis will be lateral, and the vastus intermedius is typically deep to the rectus femoris. So that will be that fourth head. You'd have to reflect the rectus femoris to see a better view of that. These are all going to be innervated. These muscles of the quadriceps are going to be innervated by the femoral nerve. And the femoral nerve is a branch of the lumbosacral plexus. And so that is kind of key here in the fact that it is not from the sacral plexus and it is not from the sciatic nerve. All right. The majority of the lower limb is going to be innervated by the sciatic nerve and its branches, but not the anterior compartment of the thigh and not the medial compartment of the thigh. Everything else will be sciatic nerve. So let's talk about that other compartment, the medial compartment of the thigh, most often referred to as the adductor compartment of the thigh, because that is going to be the main action of these muscles. You will also have two smaller muscles that are a part of this compartment. You'll have the pectineus. You'll also have the obturator externus. But we're going to focus on the adductors and the gracilis just due to their visibility. In general, these muscles are going to proximally attach to the anterior inferior surface of the bony pelvis. And their distal attachment will be on the linea aspera, which is that long line on the shaft of the posterior femur. So you can think about these having their tendons here. If they contract, they would pull the thigh more towards the midline in terms of adduction. All of these are going to be innervated by the obturator nerve, which again is not the sciatic nerve. It is also from that lumbar plexus, like the femoral nerve. It's a branch of that. So this is a distinct difference here. And I have here mostly the obturator nerve because there is going to be a hamstring part of the adductor magnus that acts basically like the hamstrings on the posterior thigh and also will be innervated differently, similar to the hamstring muscles. But we'll focus on just kind of generalizations here for the adductor compartment. The adductor longus is going to be, as its name suggests, quite one of the longer ones. It will also be the most superficial or anteriorly placed of the adductor muscles, and it will actually really serve to block the view. If you're looking from an anterior view, it'll block a good amount of the adductor brevis and adductor magnus. The adductor brevis is smaller. I actually think this illustration makes it look quite a bit bigger than it actually is. This will be very similar in terms of attachments and innervation. It'll actually, that obturator nerve will split around the adductor brevis into its two main divisions around the adductor brevis. We also have the adductor magnus, and the adductor magnus you can really see, it's going to be the most posterior of the adductor muscles. It's also, as its name would suggest, the largest, so you can see it from this superficial view, but you can also see it from a posterior view as well. And as mentioned, it is going to have an adductor part and a hamstring part, and those two parts are going to differ in terms of attachments, nerve supply, and main actions. Last but not least, we have the gracilis muscle, which is going to be the most medial of the adductor muscles. And it's not a particularly strong muscle. It's a more synergistic in terms of its actions, but it sometimes is visible, and it is the most medial. And so it's something that we at least need to mention where it is located. It will be synergistic in adducting the thigh, but it also crosses the knee as well, so it can be synergistic in knee flexion. Okay, so any muscles that have more of an anteromedial thigh proximal attachment, so from the thigh muscles, if it has a more anteromedial attachments like a lot of those adductor muscles do, but some of the muscles that play a role in terms of flexion as well. These can have straining or stretching or tearing of those proximal attachments, and this is often colloquially referred to as a groin pull. As I mentioned, it is often associated with some of those adductor muscles, as in what's showing you here, adductor longus. It doesn't have to be adductor longus. It could be any of those muscles in that region. These groin pulls usually occur in sports that require a quick start, or perhaps with extreme stretching in this area, like you can have in gymnastics. Okay, last but not least is the posterior compartment of the thigh. And these are often referred to as the hamstrings. And so let me write this out here. So posterior thigh are your hamstrings. Recall that you have a hamstring component of the adductor magnus as well. These get their names, the hamstrings, because it is common to tie hams or pork thighs up for curing and or smoking by these tendons. So that's where this name comes from. And these muscles are actually going to cross two joints as well. So they are going to cross the hip joint because they have a proximal attachment on that ischial tuberosity of the ischium portion of the coxal bone. That's why that ischial tuberosity is so robust. And then all of the muscles are also going to cross the knee joint. So these are going to be the powerful flexors of the knee joint, but they will also play an important role in terms of extension of the hip joint or the thigh. So extension of the hip joint, flexion of the knee joint. These two actions really can't be performed maximally at the same time. And try to remember what's the other main hip extensor. What is that powerful hip extensor? It's the gluteus maximus, right? So, and recall that we talked about how the gluteus maximus is really powerful, but it's really only used for when you're kind of extending from a sitting position or a climbing position, that kind of thing. Whereas the hamstrings, they're also hip extensors, and they're going to be most active in, say, walking on flat ground. So in those situations where the gluteus maximus is going to be less active. You'll have three main hamstring muscles. You will have the semitendinosus, which you can see here, it is going to be more on the medial side of the posterior thigh. And as its name would suggest, there's something going on with tendons. It's almost half tendon, so a fairly short or comparatively short muscle belly and a very long tendon. The semimembranosus typically to me looks a little posterior or deep to the semitendinosus. It's also going to be more medially placed, and it is going to have a flattened kind of membranous portion, or its tendon will be more membranous on its proximal side. That's where it gets its name. The biceps femoris is going to be on the lateral side, all right, of the posterior thigh. Its long head, and it has a biceps here indicating that there's going to be two heads. Its long head, which you can't really see the difference between the two in this particular illustration. The long head is all hamstring all the time. It's very similar in terms of these other muscles. It's going to have a similar innervation and similar actions, whereas the short head is not. It's going to actually have a big difference in terms of innervation that we'll talk about in a moment. And functionally it's different as well, but we'll focus more on that long head for now. So these muscles are going to be innervated mostly by the sciatic nerve. And really it's going to be, so the sciatic nerve is the largest nerve in the body. It is going to be a branch of the sacral plexus. It will run down the posterior thigh and divide into its two major parts, the tibial division and the common fibular. And from leg on, everything is going to be sciatic. Now, even though it is a complete nerve in this region, you can think of the sciatic nerve just kind of traveling down this region, and then it will split into its two major parts. Really, it's just those two major parts wrapped up in one nerve. So it's really only the tibial division that's sending off muscular branches to innervate the muscles back here. Even though that short head of the biceps will actually be innervated by the common fibular portion. Okay, so let's kind of put that together with something that we know from the upper limb, because there's a lot of similarities there, right? So we recall that the posterior compartments of the arm and the forearm are innervated by one nerve. And remember, I had you chant radial nerve equals posterior. Radial nerve equals posterior compartments. That way you're not have to memorize every single muscle is radial nerve. You just remember a compartment is radial nerve. Well, we have a similar pattern in the lower limb. Which nerve, and this is really a division of a bigger nerve, which nerve equals posterior compartments in the thigh? And then we'll find that this is true in terms of the leg. So which of these nerves are innervating the posterior compartments of the lower limb? Is it common fibular, femoral, obturator, or tibial? Okay, so these two right here, the femoral and the obturator nerves, are actually part of the lumbar plexus, sometimes called the lumbosacral plexus. So these are going to, femoral will be the anterior compartment. The obturator will be that medial compartment of the thighs, and so these are not correct. These two, common fibular and tibial nerves, are going to be the two major divisions of the sciatic nerve. And other than that anterior compartment and the medial compartment of the thigh, everything else is sciatic nerve. The common fibular is going to play a role in more of a role in terms of the leg, whereas this tibial division is going to be innervating posterior compartments. So even though it is still the sciatic nerve kind of running down the posterior thigh, its muscular branches that are innervating the hamstrings are going to be from the tibial nerve. So tibial nerve equals posterior, similar to how the radial nerve equal posterior for the upper limb. So we'll come to common fibular later, but really tibial nerve is where it's at in terms of posterior compartments. Okay, excellent. Thank you for working through these muscles. There's quite a few muscles, right? And these muscles are large and very robustly fibered for the most part in comparison to what we're going to see in the leg and certainly in terms of the foot region. So as you review these materials, please make sure to reach out with any questions. I always love talking the muscles in this region, and I hope you have a great rest of your day.